All right. Well, good morning and happy Friday, everyone. I'm Vicki Behar-Zussman. I'm director for the developmental core of the Center for HIV and Research in Mental Health, otherwise known as CHARM. And one of the principal investigators, along with one of our distinguished panelists today, Mario de la Rosa of the Center for Latino Health Research Opportunities, also known as CLaRO. The CHARM team is particularly thrilled to be hosting a panel led by our colleagues from Florida International University, who lead CLaRO's community engagement and dissemination core. Our panelists are all faculty at Florida International University's Stempel College of Public Health and Social Work. Dr. Mario de la Rosa is Distinguished Professor and Endowed University Professor in Health Equity. Elena Bastida is Professor and Chair of the Department of Health Promotion. Gira Ravello is, I'm sorry, oh, there you go. I lost my screen for a second. Gira Ravello is a Research Assistant Professor, and Patria Rojas is Associate Professor in Health Promotion and Disease Prevention. They're going to be discussing findings from a 5-year community level assessment of needs, resources, and existing services related to the SAVA syndemic of substance abuse, violence, trauma, and HIV/AIDS in 3 vulnerable Latino communities: farm working, urban inner city, and sexual gender minority. Their discussions are also going to include the development of the findings dissemination plan that engages community members, partnering organizations, service providers, and other stakeholders in disseminating culturally appropriate findings to the target communities in true CBPR fashion. This is a group that walks the walk. Please join me in welcoming Drs. de la Rosa, Bastida, Ravello, and Rojas.
Thank you, Vicki. We can go ahead and get started.
Thank you.
Dr. Ravello, I'm not sure if you're speaking, but you're on mute.
Yes.
Dr. de la Rosa, whenever you're ready.
Yeah, thank you. Thank you, Dr. Behar-Zussman. Thank you so much for allowing us the opportunity to be part of this panel and to be here with you guys at the University of Miami with CHARM. And also wanted to thank Dr. Safran for allowing us to be here, as well as Rosanna, who's really been working along with us. We're really excited to be here with you guys to present some of the work that we have done as part of CLaRO, and particularly the community core. So we're very excited about that. And finally, I just want to thank the community that we have worked with, that without it would not be possible to achieve and to conduct this community assessment. Could you please provide me the next slide, please, Jer? So I'm just going to provide you a little overview of the community engagement and dissemination core of the Center for Latino Health Research Opportunities, so CLaRO. Obviously, the center has 2 other cores. One is obviously the administrative core, and the other one is the investigative development course, and it has also a number of studies. But the focus today is on our community engagement and dissemination core, the work we have done, and specifically what are the aims of the score. Okay. Primarily, the aim of the score is to conduct a community level assessments on the needs, resources, and existing services related to substance abuse, violence, trauma, and HIV, otherwise known as the 7 endemic conditions in vulnerable Latino subgroups, particularly the farm working community, Latino farm working community, which is located in the southern part of Miami-Dade County, primarily Homestead and Florida City area. And also we worked along with the urban inner city community, Latino community, certain neighborhoods within that, primarily in what is called Little Havana, as well as the Miami Garden areas where a lot of individuals have been moving to. And finally, the last community to work with, which is really dispersed to throughout all of Miami-Dade County was the LGBTQ community that we worked on and conducting community assessments in terms of what were the needs, okay, in terms of the substance abuse, violence, and trauma and HIV/AIDS, and particularly, what they saw were the things that were most needed, what was lacking, and what was being done that was actually, positive in those communities. So the idea was to engage the community through a series of activities, which will be discussed, later on by the panelists, in collecting the information that was needed, engaging, also, the scientific community in FIU, who were involved also in, the collection of data, including students. And therefore, there was a whole bunch of information that was collected through different mechanisms, and that was put together. The second objective was to then take this information and develop an effective dissemination plan, translating findings from CLaRO to be delivered to the community. So oftentimes the idea is to make sure that the work that we do doesn't stay in some journal, some paper, but also goes back to the community. So we worked very hard on development and implementation plan. We involved the community advisory group of the scientific advisory group of the CLaRO in this process. They were composed of a number of members, from different agencies from the three communities that I've spoken of. And they were, really very helpful in providing us feedback how to develop this. Both actually they were involved both in the development of the ideas for the community assessment as well as the dissemination plan. And so the idea was to really get this information out. So we met, the staff of CLaRO met for a number of months, in trying to develop, or in developing the materials for this dissemination plan, which we just really have put out recently, and we're hopefully we'll be able to beginning to see the impact of this plan through, through accounts through YouTube and other social media platforms, as well as through meetings that we have been attending. There are community workers or community workers have been attending and engaging in the community through meetings throughout the Miami-Dade County area in each of the three communities. So, the idea here is that I will turn over next, the presentation to each of the three panelists who will then talk more in detail about both the community assessment component, what was done, what was included, as well as the dissemination component with some examples of some of the materials that we are using from the dissemination component that we developed to use with the dissemination component. So, very excited about this work, because I think that we hope that in the coming months, a new RFA will be released and we'll be applying for renewal, and definitely this the impact of the dissemination plan and the work that we have done here will be translated into, the submission of another grant that will include a community core that will advance the work we have already done. So without any further ado, if you have any questions later on, I can answer any other questions that you have about in general about the work that CLaRO does and in relation to community dissemination core or the other cores. And obviously, Dr. Behar Sussman is here. And by the way, we also just want to say that we're also working with Dr. Guillermo Prado, who is the PI of the Investigative Development Core. But Dr. Behar Sussman is here, and she would probably would, if there's any questions, you can also engage her. So anyway, I'm going to turn this over to Elena Bastida, who then will provide more in-depth and detailed information, and then we'll move forward with Dr. Ravello and then Dr. Butler. Thank you so much.
Dr. Bastida, whenever you're ready. You're on mute, Dr. Bastida.
I am on mute, yes. Am I okay now?
Yes, ma'am.
Can you hear me?
Yes, ma'am.
You have, yeah. Well, good morning, and thank you for inviting us to make this presentation on what we've been working on for the last 4 or 5 years. And we have worked very hard with the community. And I would like to acknowledge the work that Dr. Ravelo and Dr. Rojas have done, and as well as Antonina Calona, who is our community worker, because without them, we could not have access or the type of access that we had to the community. And for that, I am very thankful that we could not have done it without their support. So I'm just going to give you a very short overview on what we have done. And when we wrote the engagement component of the CLaRO, we were always aware that we wanted to combine quantitative with qualitative data. And so we did, we had some surveys, but I'm going to present mostly on the qualitative data that we have collected. So we began with community forums, and we did 3 of those in the 3 communities that we had targeted. So we did the farm workers community in Homestead, and we met at the Evergreen Complex for that. We did one in North Miami where we met at Pride Lines, and we did one with Little Havana with Survivors Pathway in on Coral Way. We also then follow up with focus groups in which we brought members of the community, mainly those who work with agencies that provide services to those communities. We had the one-on-one surveys, and then we presented to the Community Advisory Board last spring, and they gave us very good feedback. We did, with our qualitative data, we did thematic analyses, we coded our data, and we tried to identify the most relevant patterns and themes as they related to our SAVA theoretical framework. So just to give you a time frame of what we did and when we did it, the community forums that I just explained were done in 2018. As I said, we did 3, the farm working community, the inner city community in Little Havana, and the LGBTQ community at Survivors Pathway. And then we conducted one-on-one surveys, but these were mostly not community participants, but the agency leaders in Miami-Dade County, because we wanted to assess the resources and the services that they worked with that was available to our community. And we also asked them for a wish list. You know, what else would you do, but you can't do because you're limited in resources or you're limited jurisdictions and so on. And then we follow up those one-on-one surveys and communities with focus groups with the real community, not the providers, but the community members. And we did 3 of those, again, with the farm working community, the inner city community, which was mostly around North Miami-Dade and Little Havana. And then we did the one with the LGBTQ community. We also had or held our CSAP retreat, in which, as I mentioned earlier, we presented to the community and we to all of our advisory board members, and we invited also those who had participated in either the surveys or the focus groups or the community forum to join us. That we did while we were still not meeting in person, so it was done on Zoom. And then we worked on our analysis and disseminations throughout 2022. And so what were some of our overall findings as we brought together all the different sources of data that we had accumulated throughout the 2 or 3 year period? These themes kept coming up over and over again, regardless of who were those that shared them with us. So we had from mothers who worked in Homestead and were working and had no time to really become that involved with the schools and so on, to members of the LGBT community who in some cases were directors of agencies that provided services to the community. So what I'm presenting to you covers a broad range from just community members whose day-to-day activities and so on are totally out of our own system of research and services, and then those service providers who were very much within our world of what do you need, how do you go about doing it, and were very well documented on what their needs were. So regardless of who was attending those different sources of data gathering, youth at greatest risk. So when they consider the entire population, they kept saying that youth was basically their major concern. And when it came to violence, they did share with us some domestic violence, and the NIPV being the most, interpersonal violence being the most prevalent, so within the household. We also discussed HIV/AIDS risk behaviors. And again, they were very concerned because many of them had children who were entering adolescence, and many had adolescents who were in mid-adolescence, late adolescence, or young adults. And they felt that more education and knowledge was needed in the community, so they could advise their children, whether in the process of being at home or even after they had graduated from high school. Mental health, again, very related to substance abuse and violence. All of these are SAVA, and they come together beautifully in our data. They were concerned with, that mental health sometimes is masked with drug use, and they also felt that there were not enough mental health services in the community. And this was very much the case in the Homestead area, where we conducted several focus groups. We went beyond what we said we would do, because they had such good data to share with us. And so we kept probing, and they kept saying how these mental health services were not available, and all the different problems and difficulties that they encountered when seeking mental health services. And then they suggested to us on services and resources. And as I said, and I agree with a lot of what was said, because I like to do community observations, and I go to many of these communities and just drive around and shop and do these things. And I can tell that men in these communities are very much excluded. It's women who seek services. And I have known this for as long as I've been doing research, regardless of what community we're working with, that the women are the source of, are the ones who basically represent the agency of the family with the community. It's not the men. And so less resources available for men, that kept coming up over and over, lack of funding for services, lack of collaborations among agencies. And as you can expect, that came primarily from our agency focus groups and so forth, regardless of who the participants were, whether it was North Miami, Survivors Pathway, or Homestead. They always indicated that there was a total dearth in terms of collaboration among agencies. There were also, of course, fears of stigma. And so, for example, if your husband has a drinking problem, do you seek help? Because if you do, you bring that up to strangers in the community, that you're experiencing this, or that you're experiencing violence, or that you're having problems with your children. And that is a sign maybe that you are basically opening up your problems to the community. And they were quite resistant in doing that. And in general, they also, many, I would not say everyone, but there were many who said that the system itself creates barriers to services, because there are many forms to be filled up. There are many kinds of conditions that have to be met in order to access those services. And they not always were either capable of filling up all that paperwork, or wanted to bring all the different papers that were being asked of them in order to seek the services. So I think in general, there was agreement that there were problems with the system, and that the system itself created barriers to services. and economic problems with the farm working community. As I said, economic problems, domestic violence, IPV, sexual assault were brought to the fore. They also acknowledged that there was emerging gun violence in the community, that they were not as satisfied with the kind of HIV prevention that had been taking place in the last few years. They also spoke about noticeable suicide increases in their community, their need for more trusted advocates, and the fact that we were dealing with communities in which not everyone was a citizen actually created barriers for them in accessing services. In the urban inner city, they say vaping was rising and they were concerned. They also, again, indicated emerging gun violence. They suggested, in fact, to us that why don't you do more parent-family education or interventions? And that was suggested by them as we collected the data. And again, as with the farm worker community, the need for more mental health services. Among the LGBTQ community, they raise major concerns about the presence of methamphetamine use in the community. They also acknowledge that there were high use of drugs among all ages. They were very, very explicit about parties and money cultures that in that community were in a sense supporting and even bringing in more and more people into the culture of like money ties and substance abuse. That was an excellent group. They were very knowledgeable of their communities, and they were very passionate about the problems. And this TINA kind of methamphetamine use came up in many different scenarios, and not just the parties, but the party and the play was something that really you could tell they were very emotional about and very mad and about it. And then they also, of course, talked about substance abuse and how it was connected with sex trafficking. And they acknowledged that there was quite an increase, or they were very aware especially at Survivors Pathway, of same-sex partner violence and how it was not spoken of. We also had trans who came to that community who spoke, and this is not listed here, but who spoke loudly about the fears that they have in just walking in their communities, because they are sometimes directly attacked, sometimes verbally, sometimes not, and that police is very unlikely to defend them or to take action on their behalf. And that came up consistently in that LGBTQ, the lack of support that they had, the lack of admissions in many different instances. Even nursing homes came up as a source of being discriminatory to the trans community and to the gay community, in how whenever they had to go, friends of them went into a nursing home, they were very discriminated on how room assignments were done and how their gender was treated and so on. So there was a lot of that was spoken at that group, which they were very eloquent and very political in their statements. And then we moved on to dissemination. So thank you. If you have any questions, we can discuss later on.
Thank you, Dr. Bastida. Great. So we've actually, after myself is going to be Dr. Rojas. We purposely left the best for last, the most fun. So hopefully you guys will stick around. But I do need to get through this dissemination strategy and how we develop the materials. So now we have our findings, right? And our next step is to disseminate those findings. So we need to come up with a strategy, we need to develop it, we need to implement it. And in doing so, we use guidance from the theory of communications, and we focused on tailoring the messages to be appropriate to our target audience in language, in culture, in subculture, in using various sources of information and evidence in our messages, and applying these theories in our communication and in our dissemination strategy. Okay, so what was our strategy? Well, keeping in mind commonly used practices in dissemination, we took on a multi-level multimedia approach. We planned presentations, okay, and that would mean developing slides that were appropriate for our audience, just like the theory guides us to do, right? Meaning, was it being presented at a community meeting? Was it being presented at a community science advisory board, at an agency, or at a university? All of which we've done. So that meant tailoring each presentation appropriately. And aside from the development of each presentation, we developed materials such as flyers, brochures, and videos. And again, each one of those needed to be tailored to our target audience, keeping in mind not only general level of education, but we needed to always keep in mind the diversity of South Florida's Latino population. So in developing the materials, our dissemination team spent, I would say, painstaking hours. I think Dr. De La Rosa would probably agree with me. They were painstaking hours deciding on things like whether to use and or also, but in Spanish, because, different Latino countries will use different terms for the same thing. And I mean, I think maybe the term advisory board took almost an entire meeting, right? Because a word in one country meant a church gathering in another country or something to that effect. It was crazy. So we were pulling our hairs out because as it happens, we had a team that was made up of people from Colombia and Nicaragua and Honduras and Dominican Republic, Argentina, Cuba, Puerto Rico, Uruguay. I mean, we had them all. We had like the Latino United Nations. So you can just imagine, we were all going back and forth, no, this word, no, that word. But it was important, right? Because that's what our target audience looks like in South Florida. So although it was painstaking, we had the right stuff, actually, right? Our diverse team that was tailoring the findings was actually representative of our target diverse population, right? Of our diverse target audience. So aside from more traditional means of distributing our materials, we also needed to include social media platforms. And for that, we chose platforms that are most popular among the target audience, such as Facebook, YouTube, and WhatsApp. And of course, our dissemination has to always include publications. And I'm currently leading a paper now on the community assessment and dissemination of the data, which is what we're presenting for you guys today. And last, but by no means least, there's of course reporting to our beloved funders, which without none of us would be here today. Okay, so now to develop the materials. That was our strategy, our dissemination strategy. Now we're going to develop the flyers. Now, again, we kept best practices in mind. And for our flyers, we aim to making them bilingual for multicultural audience. The flyers were meant for community members. So again, keeping the level of complexity in mind in order for the information to be digestible. We used appropriate language for subcultures. I already told you about the painstaking story. Colors were also important in making sure they were pleasing, but not overbearing. Also making sure they weren't stereotype type colors. Our distribution methods would be twofold, in person and also electronically, which I'm going to show you a sample of actually. And I'm going to cross my fingers and God willing, it will work. And this is a sample of our flyers. Do you see it?
Yes.
Okay, great. It's now my. So this is actually one of our center Facebook group. And here we've posted our flyers. And you can see that we have all 3 community flyers. And I'll just quickly show you one. Again, remember they're tailored for each community. So you can see here, this is the inner city community. You know, we have inner city type picture there. And then we try to make, like I said, you know, the information to be digestible. This one, the flyers were meant for community members. Okay, that's a sample. That's one sample of the flyer. And I guess I can quickly do another one. This is just to show you the difference. So this then is the LGBT. You know, again, you see, you know, we use appropriate pictures. And again, each one was tailored for each community. And the findings were the findings within that community. These were being tailored, again, for community members.
Kira, can you show one in Spanish?
See if I got one in Spanish in here. So that's the one we saw earlier, which is this one in English, this one in Spanish. And again, these are posted on our Facebook group. They're also posted on the website. And we've also sent them out to agencies, and we've also distributed them in person. Okay, so that's the flyer. Now, let me move on to the brochures. Similarly, the brochures were very similar to the flyers, except the brochures were targeted towards community agencies and community leaders. So we could upscale the language a little bit, you know, include findings from all communities, include various different sources, which is where we brought in the state and local data. And we brought our qualitative findings to put into context with the quantitative data from state and local agencies. And I can give you a sample of the brochure. And again, this is again, this is electronic, so I don't know why this happened. I think it locked me out. I think it gets me out. I won't be showing the sample. Maybe after Dr. Rojas, I can show you the sample of the brochure. Once I log back in. Okay. So again, the brochure was different in the sense that it was all the communities, the data from all communities, and it was tailored more towards community agents and community leaders, so we could upscale it a bit. Okay. So although we continue to do dissemination, this is where we are so far. We've developed and conducted 10 in-person and remote presentations to community agencies. As a result of those presentations, we've been invited by the audience members to present to 4 other agencies. We've distributed materials to 87 separate agencies in person and by email. Obviously, email is nice because it's less time consuming. It's more cost effective. We've also distributed materials to 8 different WhatsApp community chats that we have networks with. And those are a combined of 364 members. So aside from the community dissemination, we've also posted on our center Facebook group, which you saw, which is made up of community leaders, mostly. I think it's approximately 40 leaders. We've posted our center on our center website. We're in the process of academic presentations, such as this one in Charm, and also at FIU. And of course, the paper that I'm currently leading on assessment and dissemination, which is right now in process. Okay, so that was a look at our dissemination strategy and our distribution methods for the flyers and brochures. So now I'm going to turn it over to Dr. Rojas, who's going to present the fun stuff. Dr. Rojas.
Thank you. Thank you for having us here, and Rosana, for all you helped putting this presentation together, as well as Dr. Ravello. So yes, we've been working with the community for over a decade and collecting data on the best way to share information and educate community members. And definitely it's video, particularly on Facebook and social media. I don't think anybody knows what Twitter is in the farm working community. And there was a question I answered in the chat regarding why Twitter was not mentioned in the dissemination. So basically, when we are out there in the community collecting data, we ask what would be the best way to share this data with you. And the answer was through videos, because most people don't have the time to read, or if they know how to read, they are not reading, but they're listening to audios and on WhatsApp, YouTube, Facebook, and Instagram. So that's what we did, because after analyzing our data, we want to disseminate it in the best way, simple language. So next slide, Jira, please. So as the previous aim with the brochures, our aim in creating this short videos was to create bilingual, videos of professional quality that could be sent via text, WhatsApp, Facebook, and even could be adapted to TikTok. I don't know if you know that videos have to be taped in a certain way, in a certain quality, in order to share on TikTok. I didn't know that. So, but I learned a lot. This is my first time creating professional videos. And another aim that particularly Dr. Ravello and I, we've been talking about, is that we need to take advantage of technology and the fact that social media is very, very powerful and is being grossly underused by scientists, particularly us who work with the community and need to reach out to communities at all levels. So in order to give back to the community and provide our information, this is so obvious, right, to use it, but it's not easy. So I went ahead and created 18 scripts in English and Spanish. Sorry, I got something here. 18 scripts in English and Spanish, and in which I basically translated our results into a more layperson language. Each script was shared with a TV producer that, again, edited those scripts to be TV friendly, if you would. So I used the results from the community core, of course, and also from one of our main studies in CLaRO, which is the Hombre study. So once the scripts were edited, then we went ahead to tape the videos, which it took us at least 9 hours in editing, recording, and then about 2 or 3 weeks then to edit those recordings. So this was again, like Jira said, long hours of editing and recording to be able to create something that would be as professional and smooth and simple as possible. Because believe me, I thought the Spanish versions and the Spanish videos are gonna be a breeze, because the Spanish is my native language, and I had a harder time is writing the scripts and videotaping the Spanish versions. So once they were basically reviewed several times by our team, including Dr. Berhard Sussman, and they were okayed, then they were kind of uploaded into sorry, I keep getting my screen, uploaded into the FIU YouTube channel in an order that we created for each video in English and in Spanish. We created a short video that will be kind of the hook or the cliffhanger. So people will kind of start watching that 30 or 40-second video, and then we'll just get them to watch the longer video. So that was that strategy that is used in media, and that was it has worked in our dissemination strategy. Another platform where we wanted to, and we did, we're sharing our videos, is in the CLaRO website. So we have an FIU and YouTube channel and the CLaRO website, and I have also shared those videos, of course, in the Cruzada Facebook website, and even my personal website as well. So we have also shared the videos through the WhatsApp groups, and it's been quite successful because we already have a relationship with those community leaders, and we've also shared through email with organizations in the community and NIH as well. Now, since the videos are on YouTube, they'll be seen, of course, by local TV media, and they also been shared with the Spanish TV channel Telemundo, and also in the Caribbean, in Latin America, I've been requested to share those videos with them. So it's been quite a learning experience for us. And I think if we go to the next slide, Jira. Well, no, actually, maybe we have we'll have the link. Can you click the one with the YouTube, that one? This one, yeah. I'm going to share with you a video on the mental health finding. So what we did, we created a video based on the findings. And if you remember Dr. Bastida's presentation, she presented on our finding on mental health and how mental health is being masked with substance abuse in the community. And so in our video on mental health, I present on the 3 communities, so the mental health issues that came up from the community forums and the interviews and the focus groups on mental health. Do we have it, Jira? The English one we can get from the CLaRO website. Yeah,
Should
no.
should I click on the YouTube?
Click on the YouTube icon, and then
Or-
that will take you to the CLaRO website, and then you will click on number 5. Oh, it will. We have to be patient with technology. And you got it? Oh,
So, but yet technology is not patient with me.
technology is not helping.
We go.
You got
Which
it?
one did you want? Number 5?
Share your screen so they can see also. It looks quite nice because you have all the videos on the website. I cannot see your screen. It says double click to enter full screen.
Do you see the full screen?
It looks like it's loading.
It's loading because it's like big, I think. I wanted to show also how
In the meantime, while that loads, I'm gonna
because in order to upload the videos on YouTube and make them more appealing, if you would, to the audience, we had to put some text and some questions. So so you will see how it looks and try to make them, since there are a total of 36 videos. There's a short one in Spanish, a long one in Spanish, a short one in English, and a long one in English. We have so many videos that we've created. We needed to make a difference. What happened?
Is there one here that you want to see? Oh, just got it.
I don't see your screen. Is anybody seeing your screen?
Yeah, it looks like it might not be working. What we can also do is send those out on
They will.
So
I had this.
Let me just share my
I had the screen up. You can see it.
no.
Okay.
Let me just share my screen, Jira. I'll
Okay.
share my screen. So can everybody see my screen? Can everybody see my screen?
Yeah.
Yes.
Okay, so what you see here is the list of all the videos that we created. Okay, the English, the brief. So I'm going to show you a short in Spanish. and a short in English.
Let's hope it opens.
Okay.
And if you want, I can also send out these links afterwards, so that
Sure.
you can
Just the link of the CLaRO website will take you to all the videos.
Perfect.
Okay. Oh, I hope my sound sharing was clicked.
We're still seeing the document. I'm not sure if maybe it opened separately.
Oh, because the can you see the video?
No.
No, we're still seeing the Word document.
Okay, let me go back and reshare then. I go back and reshare. There and then share. Okay. Optimize. 1 second. It's gonna happen now. There.
¿Sabías que existen necesidades de salud mental similares en las diferentes comunidades de Miami-Dade? Hola, soy la doctora Patria Rojas y bienvenido a Compartiendo Data de Miami-Dade. La demanda de servicios de salud mental ha aumentado a nivel mundial, incluyendo Miami-Dade. En un estudio reciente, investigadores de la Universidad Internacional de la Florida descubrió que las personas del centro de la ciudad, los trabajadores agrícolas y la comunidad gay, lesbiana, bisexual y transexual, GLBTQ, por sus siglas en inglés, que vive en el centro de la ciudad, informaron que hay 2 problemas importantes asociados con el acceso a la salud mental. Si quieres saber cuáles son, visita nuestro enlace.
Did you guys see that video? Okay.
That's an example. No, many.
Huh?
That's an example.
Yes, that's one example. So I'm gonna show you the English one here. Short. Oh, hold on. Let me show you the same one, but in English. Open here. Okay. Go. It's loading. Okay. You cannot see the video yet, right?
Not yet.
You can.
¿Sabías que existen necesidades de salud mental similares en las
We can't see it.
comunidades de Miami-Dade?
Can you guys see the video?
No, it's in Spanish too. The other one. Well, anyway, Patria, you know, I mean,
Okay. Well, I'll share the document with all the videos, but basically you have those short videos with the link to the long videos, and what we sent is actually the short video, because that short video has the link to the YouTube. Actually, on that on the slide presentation, Jira, there is a direct link to the English one if you want to bring it up. I had it done. Maybe that will be also a simple way to do it. Maybe that will work for you. So that's it for me. I just wanted to give you a taste of what the videos look like. So I think we're open for questions now.
And I know that we're running a little bit short on time, so I did send a satisfaction survey in the chat if you wouldn't mind filling that out. And I'm going to take a quick moment to plug our next co-hosted panel with CLaRO, which is going to be on January 25th. Study team management, skills, strategies, and supervision. So we'll be sending that flyer out around, but please go ahead and ask any questions that you have. Ray?
Thank you. The videos, that's beautiful production. So I have two questions. What were your lessons learned for other people who wanted to produce high quality videos like that? And two, why YouTube? So I stopped using YouTube when my students were reporting they were getting ads for President Trump during my lectures. So did you look hard at using other platforms?
Well, the lesson that I learned is that it takes longer than what you expect to produce these videos, because particularly, I always say that when you work in two languages, it's more than double the work, because you have to not only translate it from, the scientific jargon into the layperson's language, but also into a kind of neutral language. So that's one. So it took me longer than I expected to produce the scripts. And then those scripts have to be tweak it to fit a media, form. Even the when you record the videos, because you make mistakes. There's an S, there is an intonation, body language. It's everything. If I didn't smile, it's a lot when you recording, because everything has to, come perfect. Perfect.
Mm-hmm.
The light, we started recording at 9 o'clock in the morning. When it was 2 p.m., the sun is in a different position and change the lighting, and then it looks different and everything. So and we finish around 6:30, and obviously the sun is in another position. And it's just like photography. You have to keep changing the lighting and the windows and everything. And so that's, and then the editing after that also. I remember Dr. De La Rosa and other people, why they're not ready yet. I'm like, you don't understand. It takes a lot of, editing, and then the text. And even so they had to be perfect. I worked also a lesson that I learned is that you have to work with a TV producer, someone that knows the field, and they have to be good enough for him in order for him to send it to me, and then pass my test to send it to the team. So it was a long process. Yes.
Cool.
And
Thank
why
you.
YouTube? Because we respond to the community. And let me tell you, I don't have a Twitter account, because I use the account for work, and my community, they don't use Twitter. And YouTube is what people watch there. So it does. If I use another platform, no. Not even TikTok, that is very popular with young Latinos. Adults, no. And Instagram is mostly used by Venezuelans and more educated members of the community in the urban setting, because we have urban, semi-rural, and then we have the LGBTQ plus, and of course they would probably use Twitter, but that's and we're working on that. But it's a lot.
Cool. Thank you. That's incredibly valuable, because it's just you work with such a diverse group of people. I salute you, because that must have been obviously it was must have been incredibly difficult to get that right, and it just looks beautiful.
The word is painstaking.
Yeah,
that is the word of the day.
Yeah.
And Dr. Rojas is correct. I mean, we respond to the community. We've had several focus groups, and there was another study we were doing with COVID, and more focus groups, and YouTube comes up a lot, with these groups and this population. And we needed to try and focus in the top 3 most used platforms. Otherwise, we could go crazy with multimedia. But yeah, in focusing on the top three for sure, YouTube is up there, WhatsApp is up there, Facebook, believe it or not, is still up there, you know, with these communities. So yeah, like Dr. Rojas says, we just respond to the community. I think your students are, you know, definitely in another dimension.
Yeah, and any ideas that you might have in terms of where to disseminate this information would be welcome, because we're in the process of disseminating the information to different audiences. So if you have any ideas that you can help us with, they're welcome. Okay, so let us know, please, because we want to get this information out to as many people as possible, you know, so please.
I frankly, I ask because I'm struggling with it. So in my world, I do data science and statistics. Everyone has fled Twitter. Everyone, all of the influencers have left Twitter, and they're going to Mastodon and other places as alternatives. And I'm like, what's Mastodon? And so I'm trying to think through how to get messaging out. And so it's incredibly challenging. So
Yes, what I learned is that it has to be tailored, and it has to be specific to the community. Like, for example, radio is what works the best with the farm working community. So we go to the radio, and also WhatsApp, because they use WhatsApp to call their families in Mexico, and the Latinos use WhatsApp. So you send those short videos to WhatsApp, and they'll get it there. And it has, you know, they listen to it, because another thing is that the reading, they don't really have much time to read, even if they know how to read. So
Yeah, and being able to call and text their country of origin for free like that via WhatsApp, that became their application of choice.
Awesome. I know we're a little bit over time. Is there anything else, any other comments or questions that anybody has before we wrap up? All right. Thank you all so much for joining us. This was incredible. I have the recording as well. I can share it with you so we can also put it online and have people learn about this. Thank you also, Vicky, for introducing the panel, and thank you all so much for joining us.
Thank you. Bye.
Bye.